Hi all. Today our topic is going to be about root resorption. So it's a very important question for a final year point of view. It can be asked in your essay as well as individual type of resorption in a short note also. Okay. So these are the contents. As I always tell, start off with putting a content box. It gives a clarity and fetch you marks. Basically, what is resorption? See, it's nothing but a body's reactive mechanism whenever there is any type of injury happening to your pulp or a periodontal tissue. See, basically, in a deciduous teeth, a physiological resorption will happen. Then only a permanent teeth will come. That is physiological. But when it happens like pathologically due to any trauma or an infection, then it is called as a pathologic root resorption. So there are many definitions. So for undergraduate level, you just need to know about the one which is given in your Grossman. Probably Cohen definition is also good. Resorption which happens under protective layer. So what are the various protective layer? On the root surface, you have a cementum. On the enamel surface, your enamel and the dentin. On the pulpal surface, on the crown portion, it's dentin. So whenever there is a resorption happening in these two, it results in further damage to the tooth structure. Apart from that, in resorption, we have two types: internal resorption and external resorption. As the name suggests, internal resorption means resorption happening in internal part of the tooth, especially within the pulp. Okay, it's a kind of a slow type of resorption occurring in the dentin of the pulp chamber or the root canals of the teeth. Whereas external resorption is nothing but it happens on the external surface of the root, especially on the cementum or the dentin of the roots of teeth. This is how we have to remember the definition. Okay. And classification is very important. So broadly it is classified as internal and external resorption, and in both there are three things which is common in both the type of resorption. You have surface type in common, replacement and infection related. Always remember, surface type of resorption is a very minimal type. It's a kind of a repair mechanism. Okay, whereas your replacement is also a repair mechanism, whereas ankylosis will happen, your bone will get deposited. Whereas the most damaging of all these three types is your infection related. So apart from that, in external resorption, we have other types like spontaneous ankylotic resorption, external multiple sites of resorption, and cervical invasive resorption. Okay. Basically, apart from this classification, you need to know about the classification of cervical resorption also, because it's very important given by height say. So you just remember this diagram: class 1, class 2, class 3 and class 4. See, in class 1 you can see some red color image. It's very minimal, so it means a very small resorptive lesion occurring at the cervical area, and there is no much penetration into the dentin. Whereas in class 2, it's like a well defined resorptive lesion that has penetrated the dentin and has reached close to your coronal pulp chamber, but it has not extended into radicular dentin. Okay, whereas in class 3 you can see that red zone has started entering into your radicular portion, which means a deeper invasion has happened. Whereas in class 4 you can see it's a large invasive resorptive process that has extended beyond your coronal third of root. So basically it all happens in your cervical part of tooth. That's why it's called a cervical resorption. It is just classified into class 1, class 2, class 3, class 4 depending upon how much it has invaded your radicular portion. Okay. Okay, what are the requirements? So as I already told, whenever there is any injury happening, like an intrusion, avulsion, or whatever luxation injury, your first thing that gets damaged is your protective layer. So what is the protective layer? In root portion, it is cementum, and in your coronal portion, your dentin. So these both actually protect your pulp and the periodontium, right? So when these are getting damaged, there will be severe inflammation of this pulp and periodontium, because of which a lot of inflammatory cells like giant cells and clast cells will come. So when osteoclast come, what happens? Automatically resorption will happen. Resorption. Your protective layer is getting damaged and there's a severe inflammation happening. So what is an inflammation? There are two phases in it. One is a destructive phase, one is a healing phase. The first thing that happens is a destructive phase. So massive destruction will happen in everything. That is where this active resorption takes place. Apart after that, your body will start to heal. So the healing will depend upon what type of cells come to that area of damage. For example, if cementoblast comes, blast means what? It's a forming cell. So it's a kind of repair related resorption. We saw right the classification, the first one, that is what is this surface type of resorption. Whereas supposing osteoblast is coming, then ankylosis will come, like bone formation will come. So this is kind of a healing phase. If the resorption continues very severely, a lot of inflammatory type of cells keep on acting without any repair, then that results in your inflammatory type of resorption. Okay, this is a diagram of how your inflammation will look. In figure 4b, you can see how a resorption looks like. Okay, on the root surface there is some small concavities you can see. Now this is how a resorption will look like. Then mechanism, as I already told, the various cells will come, osteoclast, odontoclast, giant cells, and they will keep degrading your inorganic and organic substance with the help of your collagenase, MMP, your carbonic acid. So much of acids will be produced at that resorption site, because of which will keep your root will keep on be resorbing. Okay, the pH will be very acidic. So talking about individual type of resorption, just in whatever type of resorption the question comes, you have to write what is an etiology, how it looks clinically, how it looks radiographically, and what is the line of treatment, and a small diagram. This is how we have to write a question. So external resorption, as I already told, it's a resorption happening on the external surface of the tooth, especially on the cementum or the dentin from the roots of tooth. So there are three types: repair, that is otherwise a surface type of resorption, inflammatory, and ankylotic. So under repair type of resorption, it's a very small type of cavities. Usually it will repair on its own, no need of any treatment. And etiology, minor traumatic injuries like concussion, subluxation will result in it. So this is how it looks like in your image. See the X-rays, a small concavities will be seen on the external surface of the root. So radiographic changes, a very small cavity will be seen. No need of any endodontic treatment unless otherwise patient is so symptomatic. Otherwise, if trauma or pressure is relieved, the repair will happen 100%. One is your infection, that is inflammatory type of resorption. This is the most aggressive and progressive type of resorption, wherein there is a trauma happening, like an intrusion or reimplantation process that has been done in case of an avulsion. So all these, if that's combined with the injury to the pulp, and wherein there is so much of infection and necrotic pulp is already there, then the resorption happens tremendously fast. So this is your inflammatory type of resorption. Again, the clinical findings, tooth will be extremely mobile, and when you percuss and see, you will hear a dull percussion note. Sometimes your tooth will look extruded from the socket, and when you do a pulp sensibility test, it will be no response, and sometimes sinus tract can be seen. What is the radiographic feature? So look at the diagram. The fourth diagram in this radiograph, you can see there will be so much of concave ragged borders on the external outline of root. This is how an external inflammatory type of resorption will look like. It will be so severe, so much of concavities will be there. Okay, if you are going to leave it untreated, you have to start endodontic treatment as soon as possible. If you are going to delay it, what happens? It will go and communicate with the internal surface of the pulp cavity and results in internal resorption. Then it happens like a communicating type of resorption. That's why we tell this type of resorption is very aggressive and you have to treat it as fast as possible. So this is the treatment part, and always remember, for an RCT or for absorption case, you cannot do in single sitting. You have to always do multiple sitting by placing multiple dressings of calcium hydroxide like for 2 to 3 weeks. This is done to reduce the acidity, the pH that is being created there. Then this is a replacement type of resorption. Again, it's because of a trauma, and clinical findings, patient will be asymptomatic except it will be very firm in socket, and when you percuss and see, you will hear a high metallic sound. This is an important MCQ question. So this is how the radiograph will look like. Your root structure will be completely replaced by a bone, and your pedial space will be completely lost. And only if pulp is becoming necrotic and if any signs of pulpal necrosis is seen, you have to start the endodontic treatment. Otherwise, it is not required. The treatment, younger the age, more pronounced the resorption, more will be the infraocclusion. And according to Engel, there are 5 treatment protocols. Just know the names. Okay, the next one is your cervical resorption. This is one which I told initially, right? There's a classification, 4 type of classification. The one which happens to the cervical aspect is called the cervical invasive resorption. And etiology, again, it's because of ortho treatment, acute trauma, and cervical restoration. These are the other names, the classification. So this again can be asked as a short note. And the pathogenesis, usually it happens very small in the cervical aspect. Later it gradually enlarges to involve a larger portion of dentin between the cementum and the pulp. And what happens now, over a point, it will gradually spread in both coronal and radicular portions. So it will be seen clinically as a pink spot in the cervical aspect. Okay, usually it will be asymptomatic, but later a long-standing case will result in pulp infection. Pulp will get perforated and patient will become symptomatic. Clinically, you will be seeing as a pink spot in the cervical aspect, because your dentin is getting completely resolved. So this is how a radiographic feature will look like. See, on the cervical aspect, you are seeing some bowl-shaped lesion and slowly progressive on both sides. Initially, the pulp canal is intact, but later it will tend to involve the pulp canal also. And you have to start the endodontic treatment as soon as possible. These are the treatment objectives. So you can do a non-surgical method, but if it is very severe, you have to raise the flap, you have to remove all the granulation tissue, and you have to repair with the help of a MTA or any other bioceramic materials. And again, the prognosis will depend upon how much extent the resorption has extended in the radicular portion. So internal resorption again it is the same thing, but the difference is that here the resorption happening within the root canal. That is internal resorption. Okay. So clinical features. Again, it is of three types: surface, inflammatory, and replacement. Everything is same. The difference is that when you take an X-ray and see important viva question. So this is how our internal resorption will look like. Say externally it was happening on the external surface of the root, but look at the internal resorption. It is happening within the root canal. So in the root canal, suddenly you can see a sudden enlargement, oval shaped enlargement, radiolucency of the root canal. So this is your internal resorption. Okay, replacement again the same. The bone will get deposited in that. So yeah, this is very important tabular column. Man. So this is just a summary of whatever we have seen till now. The main radiographic feature that they will ask is that what is the difference between internal and external resorption. Always remember in internal resorption, the resorption is happening within the root canal. So whereas in external resorption, it happens only on the external surface of the root. But sometimes if you are not treating your external resorption and it gets spread so rapidly and involves the pulp canal, it becomes a communicating. So then how you will differentiate whether it's external or internal? So that can be asked an important question. So remember, when you're taking multiple angulation x-rays, mesial and distal angulation, supposing your lesion is moving along with the canal, then it is internal resorption. Whereas if your lesion is moving away from the canal, it means it is external resorption. Understood? So if it is moving along with the canal, it means the lesion is wherever you shift the x-ray, it is within the canal only, which means the infection is within the canal. That is internal resorption. Understood? It's a very important question. And your root canal outline is normal and it runs through the radiolucent defect. Okay. Whereas in the internal resorption, the root canal outline is completely damaged. It's distorted. Okay. That's it. So this tableau column is very important. It's given in your gross. These are the references. Okay.